So to give you a little context, Bruce Lockwood is the Vice President of the Community Health Division for Professional Research Consultants, or PRC as we like to call them. We've partnered with PRC on our Yellowstone County Needs Assessment since 2005. So in other words, this is our 5th rodeo. PRC and Bruce bring a tremendous amount of experience and expertise to this type of research, and they've actually done hundreds of assessments across the country for more than 25 years, and in theory have covered 1/3 of the US population with their data collection. So without further ado, let's give a hand to Bruce.
Thank you. Thank you. Can everybody hear me okay? Well, sounds like it's working, good. So, good morning. Happy to be here to share with you some of the information that's come out of this needs assessment. And this is information that is very new. So this is really hot off the press. We gave a preview to the sponsors just a week ago. So this is really the first broad audience to see this information. So it's exciting to share this today. So I know Melissa touched on some of the reasons why we do the assessment, the length of the history of doing this assessment in Yellowstone County. I wanted to start out my piece with a little bit background about how we went about getting this data, just so you understand going forward what data you're looking at. So of course we looked at existing data that's out there in the public health data sets. It's information we get from death certificates or birth certificates or other sources. The census also reveals a lot of information relative to the needs of this area. Melissa mentioned also that key informant survey, and there's probably many of you in this room who took part in this. And this was an online survey that we shared with stakeholders such as yourselves, health providers, but also social service representatives and various types of community leaders. And in all, we got input from 154 stakeholders in the community, giving us their perspective. And I'll have one slide that I'll share with you a little bit around the results that what we heard from key informants. And then probably the cornerstone of this assessment, and historically what has given us the bulk of the data for this assessment, is a population-based survey or household survey that was done in the area. And it really is designed to target specific health status, behaviors, and needs of our residents. Historically, this goes back to the work we started in 2005. As Melissa mentioned, this is now our 5th iteration. So really a true value of this ongoing commitment to data collection is that we have some really strong trends that now reach over 15 years worth of data. A little bit more about the population survey. It was based on responses from 400 randomly selected households in Yellowstone County. It was a very long survey. It was over 125 questions long. And I know that it surprises folks, but we're able to get really good participation. And with the survey tool, we're able to get a lot of information that we can later drill down into. The sample size gives us a very respectable plus or minus 4.9% error on the data. And really what's most important is I want to share with you what's here at the bottom in this chart. And that is that the sample that we ended up with looks very much like the population of Yellowstone County in terms of things like the gender breakouts, the age groupings, income level, race, ethnicity. Essentially in this bar, the lighter colors bars represent the proportion of different demographics it revealed in census data. The red represent those same proportions in our survey sample. The takeaway being is this looks very much like our county, and that's what allows us then to generalize these more broadly. So as I go through the data portion this morning, I'm going to share with you I'm going to focus largely on what we identify as areas of opportunity or significant health needs. So it's really just a fraction of all of the data that we collect. And I'm going to focus a little bit on what are the challenges that remain for Yellowstone County. There were a lot of positive findings and a lot of additional detail that's going to be forthcoming in that final CHNA report that will be coming out soon. As we move into the second part of the presentation today, we're going to take a little bit of a break, and then we're going to reconvene you to get your input around what you see from the data in terms of what should be our priorities going forward. And we'll explain a little bit more about that process as we get there. So the first thing I want to share with you is one slide that gives some, reveals some of the input that we got from key stakeholders. Again, these are health providers, physicians, other types of health providers, public health, social service representatives, various types of community leaders. And that was an online survey. Again, many of you may have taken part in that. And if you recall, at the beginning of that survey, we presented 20 health issues. And we asked you to rate each of those as a major problem, a moderate problem, minor problem, or not a problem in Yellowstone County. So I want to share with you a little bit of what kind of arose to the top. So in terms of those major problem responses, mental health, substance abuse, clearly top concerns for stakeholders. Over 70%, 80% in the case of mental health consider those to be major concerns, major problems for Yellowstone County. There's a pretty significant drop in response for the next level, kind of the next tier of issues, diabetes, nutrition, physical activity, and weight, tobacco use. Those round out kind of the top 5 concerns that we heard from key informants. The key informants also gave us a lot of contextual information that will all be included in that ultimate report going forward, explaining reasons for their perceptions here, as well as identifying gaps in services, populations that may be falling through the cracks, for example. So that will be detailed a lot more in the upcoming report. But I wanted to share this today because I want you to keep this in mind as we go through and look at some of the other data that we've now collected. Keep in mind, these are responses from key informants in the community. This reflects a lot of the work that they do, and oftentimes they work with the most vulnerable in our community. So as we go through, kind of keep this in mind as we see how does this mesh with the other data that we collected. And ultimately, at the end of today, we want to get your input based on not just this, but also all of the other data we collected around what you see as the top priorities. So walking through the data, this is kind of a roadmap of where I'm going to go today. I want to start out with a couple social determinant indicators, a measure of overall health status, but I'm largely going to share a few slides around each of these 13 health issues that emerged as what we call areas of opportunity. And you'll notice here that those are alphabetical. Again, we're going to get your input around what the order of these should be in terms of priority. So with no further ado, looking at some of the questions we had in our survey around social determinants of health, quality of life in Yellowstone County, I wanted to share something here. This is also on one of the placemats on the wall if you want to look at it in further detail during the break. But when we look at the data that we collected, one of the key themes that comes up is that income is really very good predictor of how healthy our residents are. Overall, Billings and Yellowstone County residents enjoy a high quality of life, but health and quality of life are not equally distributed in our communities. So for example, some of the largest gaps that we saw between lower income individuals and those with middle or higher incomes were around things like food insecurity, health-related activity limitations, housing stability in terms of anxiety around being able to afford your rent or mortgage, access to healthy foods, the impact of substance abuse in our lives. Those are very different experiences for those with lower incomes and those with middle and higher incomes. And we'll highlight a lot of these as I go through some of the data today. Another question in our survey was more perception-based, but we asked people to tell us how much they feel that they are personally able to impact quality of life in this community. And most people feel empowered, to at least to some degree. 32.6% feel that they themselves can make a great deal of impact on community life. 58.6% some impact. But about 8.8% feel completely disenfranchised, with perceiving to have no impact on making this community a better place to live. And that was pretty consistent across demographics. That percentage did not differ significantly by gender, by age, or even in this case by income level. We also asked about things like neighborhood safety. And in this question, we asked specifically how safe people feel walking alone in their own neighborhood. About half feel extremely safe, 48.7%. Almost 40% said in that middle category of quite safe. But then 11.7% said they feel only slightly or even not at all safe walking in their own neighborhood. That response was higher in younger adults, more so than those in middle or older age groupings. We also asked people how often they feel that they have the social and emotional support that they need. And this is the distribution of responses. Again, almost half feel that they are always supported socially and emotionally. 29.7% usually, 16.6% said sometimes. At the lower end, 4.6% feel seldom or never supported. Again, we didn't see significant differences in those responses by some of those key demographic characteristics. Moving on to more traditional health measures. The first thing I want to share with you is actually the very first question in that household survey. And we asked people, overall, would you say in general your health is excellent, very good, good, fair, or poor? It's also one that's fairly perception-based, but I'll share with you it's one that's pretty strongly correlated to a lot of the other measures we'll talk about today. And you can see here about half gave one of those top tier responses of excellent or very good health. About a third think their health is just kind of in the middle of the road, good. 16.7%, however, rated it as fair and poor. Looking at that in a couple different ways, that's a question that's also asked in a statewide survey that the CDC conducts, as well as a national survey that my firm, PRC, conducts. And you can see that that fair-poor response is fairly close. And statistically, it's not different than what we see statewide or nationally. And as I mentioned, trending is also a huge value of the history of this project in Yellowstone County. And you can see here that the current prevalence, although it's significantly above that baseline measure back in 2005, it's remained fairly steady for the last four iterations here. In terms of how this looks for different segments of our community, not a great difference by gender. It appears to be a little bit correlated to income, but really the key measure is, as you might expect, age. And in fact, as we get older, those responses do increase. About 30% of those age 65 and older characterize their health status as fair or poor. So I want to move on to what we call these areas of opportunity. I've got 1 to 3 slides around each of these. And I want to start out alphabetically again with access to healthcare services. And we had a number of questions in our survey that looked at access as well as some of the external measures we looked at. By and large, health insurance coverage appears to be fairly good in comparison to state and national levels. In terms of adults 18 to 64, we found 6.4% without any type of insurance coverage, whether that be through private sources or through some type of government-sponsored program. But we know there's also a number of other things that can impact a person's ability to access health care. And in fact, in our survey, we asked 7 additional questions around potential barriers to health. And that's what each of these bars represent. For example, we found 14.3% of all adults in Yellowstone County said there was a time in the past year when they needed to see a doctor, but they did not because they couldn't get an appointment when they needed it. 10.5% didn't go to a doctor in the past year because they couldn't get there during office hours. 9.2% didn't go because of the cost, whether they didn't have insurance or couldn't afford the copay, the deductible. 9% went without a needed prescription because of the cost. 8.6% didn't go because they couldn't find a doctor to see them. You can see that this percentage of cost of prescriptions, that barrier has actually improved since we first started measuring, and ability to find a doctor has also actually worsened. Some additional barriers that impact smaller proportions are things like transportation, language, and cultural barriers. Now, these are all questions that are also asked in a national survey that PRC conducts. And in comparing to what we see across the nation, actually, these first 2 are statistically similar, but all the remaining barriers are actually better, lower than what we see nationally. So by and large, we find that residents in Yellowstone County have pretty good access to health care, although we do still see some segments that struggle with some of these barriers. Another finding that we saw is that in comparison to some of the earlier data that we collected, fewer adults seem to have an ongoing relationship with a particular healthcare provider. So 77.6%, about 3 out of 4 adults, were found to have a specific source of ongoing medical care, meaning there is a particular doctor or doctor's office or a clinic that they go to for their routine health needs. If someone said that they usually go to the ER, that does not count in this category as having a specific source of care. Although our numbers are close to what we see nationally, they have declined. Despite that, we actually see that routine checkups in adults have actually improved over time. About 2/3 say that they've had a routine checkup in the past year, which is better than what we had seen in past years, particularly from that baseline study. It's close to what we see nationally, a little bit below what we see across Montana as a whole. The next area I want to talk about is around cancers. And cancer, in fact, in Yellowstone County is the 2nd leading cause of death. In 2017, the latest year that we have data for, about 1 out of 5 deaths among residents in the county was attributed to cancers. We also looked at mortality rates, age-adjusted death rates associated with cancer, as well as leading cancer sites. And when doing so, we saw relatively higher death rates as well as diagnosis rates in Yellowstone County compared to what we see across the state or the US relative to prostate cancer in men as well as breast cancer in women. Other leading cancer sites were fairly typical. Diabetes is next on our list, and we looked at a couple different measures. From the public health data, we looked at death rates associated with diabetes. And in the latest reporting years, the mortality rate in Yellowstone County is actually below what we see across the state in the US. Yellowstone obviously here in red, blue is the US, green being the state of Montana. But that hasn't historically, although it has dipped down in the latest years a little bit. So I would say that this is a trend to watch, to see if a clear trend develops or if it stabilizes over time for the county. In terms of what we learned from our population surveys, we're able to estimate the percentage of adults who right now are living with diabetes in Yellowstone County. And that percentage we learned was 12.5%. It's higher than what we see at the state level, closer to what we see nationally. It hasn't changed significantly over time. That's been relatively stable in our survey data. And although there appears to be some correlation with income, it really is age that is the strongest and clearest correlation. As we get older, these diagnoses of diabetes increase. And this is what we see in really every community that we work in, is that diabetes is first and foremost very age-related. For adults 65 plus, roughly 1 out of 4 has been diagnosed with diabetes. Now, in addition to this 12.5%, we also found another 6.4% of adults in Yellowstone County who say they've been told they are pre-diabetic or have borderline diabetes. So that's an additional at-risk group. So between those two, we're approaching about 1 out of 5 adults with some blood sugar regulation issues. Heart disease and stroke, if we look back at that distribution of leading causes of death pie chart, heart disease is the #1 leading cause of death, edging out cancer with 21.2% of all deaths attributed to heart disease. Stroke, which shares many of the same risk factors, contributes another 5.3%. So together, about 1 out of 4 deaths is related to cardiovascular disease. Now, in our survey, we looked at some of the risk factors associated with heart disease. Specifically, I'm sharing here the prevalence of high blood pressure and high cholesterol in the community. You can see on the left that we've seen a fairly straight line increase over the years, over the last 15 years, in terms of the prevalence of high blood pressure in our population. And currently it sits about 40% of adults who've been told that they had high blood pressure. High cholesterol appears to be much more stable over time. In fact, we're not significantly different from when we first measured this. Some of these indicators that I'm sharing also have what we call Healthy People 2020 targets. And these are national disease prevention and health promotion goals that are set for the US as targets for the population to reach by the year 2020. Clearly, we are far from reaching both, specifically heading in the wrong direction as it relates to blood pressure. We're hoping that the federal government will be releasing revised goals for 2030 in the coming year as well. So we'll have to see how those might be adjusted. One chart that I wanted to share around infant health relates specifically to infant deaths and infant mortality rates. Historically in Yellowstone County, we've had infant mortality rates that are above both state and national rates. You can see over roughly the last decade, in each year we have been higher. That remains to be true. While we saw some declines in the kind of late 2000s, we've seen some increases in the first half of the 20-teens. So it remains to be seen where that is going. This is currently currently outside the 6.0 Healthy People 2020 target, and more clearly above what we see statewide and nationally. A couple slides I wanted to share around injury and violence. So we looked at deaths occurring in Yellowstone County to residents of Yellowstone County and looked at what were the precipitating causes of those accidental or unintentional injury deaths. And first and foremost, we had about a third that were attributed to falls, direct or indirect result of falls in residents. 25% are associated with motor vehicle accidents. The third category here, which is technically called poisoning or noxious substances, is 18.7% of that pie. That also includes accidental drug overdoses. In a lot of communities, I'll share with you that we are seeing this move up to the second and even first position. Some other facts around injuries. I'll talk a little bit more about the drug overdose piece when we get to substance abuse. But looking at age-adjusted death rates associated with unintentional injuries, falls and motor vehicle are both notably higher in terms of the rates of death than what we see across the US. Motor vehicle crashes is, however, better than we see statewide. In other parts of Montana, it's deaths associated with motor vehicle crashes are actually quite a bit higher. In terms of the injury side of things, the one data point I wanted to share with you was something we learned through our survey when we asked adults whether they have ever been hit, slapped, pushed, kicked, or hurt in some way by an intimate partner, whether that be a spouse, someone they are living with or dating, a boyfriend, a girlfriend, for example. 21.9% say that they have had experiences of intimate partner violence or domestic violence. Higher than we see in a national survey, also much higher than we've seen in past years. This was first asked in 2010. It's much higher there, and even from what we saw in 2014, 2017 as well. The next topic area is around mental health, and recall that this was really the top concern for folks who took part in that key informant survey. So I wanted to share some data around what we learned through the other parts of our data collection. So one question that we asked people was, in that household survey, was to evaluate their overall mental health status. So much like that question I talked about earlier, we asked them, in terms of things like anxiety, depression, or problems with emotion, would you say that your overall mental health is excellent, very good, good, fair, or poor? This percentage, 20.2%, represents adults who rated it as fair or poor. That's higher than we see nationwide. It's also the highest that we have seen historically when asked this question in Yellowstone County. In fact, the baseline measure in 2005 was 6.9% fair poor. Pretty steady increase. I'll share with you, this is not very different at all from what we see in most of the communities that we work with. We've seen similar trends in all parts of the country relative to this question, as well as some of the ones I'll share here in a minute. We also found that about a third, 32.2% of Yellowstone County adults say that they have been diagnosed by a healthcare professional as having some type of depressive disorder. That is also much higher than we see in the latest data statewide, nationally, also much higher than what we've seen in the area in past data. This question has been asked now for 3 survey cycles. First in 2014, when it was about 21%. A similar but slightly different measure asked people about symptoms of chronic depression. And what this finding shows is that 38.5% of adults in Yellowstone County say they have had 2 or more years in their life when they felt depressed or sad on most days, even if they felt okay sometimes. So really kind of a history of prolonged periods of feelings of depression. That too is higher than we see nationally, also higher than we've seen historically, and increasing pretty consistently and sharply since 2010. In terms of the demographics of this, really the disparities we saw were by gender. It was higher in women than in men. And then also significant differences in terms of low income versus those at middle or higher incomes. As I'm sure many of you know, suicide is also a measure that has historically been quite high in Montana, statewide. Yellowstone County is no different, and in fact, it's tracked pretty closely to state mortality rates for suicide for much of the last decade. And you can see both of these are significantly higher and increasing more sharply than what we're seeing at the national level. And in our survey, we actually asked a question about suicide. We asked people whether they have ever seriously considered suicide. And in Yellowstone County, we found that about 1 out of 5, 21% have. If for those people that we sampled who also reported some of those depression disorders, it was about half who said that they had considered suicide, 21% of the population overall. That has increased and continued to increase in recent years, unfortunately, as well. So demographically, as I've noted here, income was really a strong predictor. And those in that low-income category, which correlates with the 200% of poverty threshold, which is about $52,000 for a family of 4. So for those folks in our survey who fell below that income threshold, suicide ideation was 36%, so notably higher than what we see in the population at large. Next, alphabetically, issues around nutrition, physical activity, and weight. And part of the survey that we conducted with households, we asked our respondents to give us their height and their weight. And then from that, we calculated a body mass index, or a BMI value. And that BMI value is what puts a person in a category of being underweight, healthy weight, overweight, or obese. So looking at folks with a BMI of 25 or more, meaning that they are either overweight or obese, we found that 72.7% of adults fall into that category. The trend line doesn't show any clear trend in terms of that overall measure. But if we look at just the segment that are obese, meaning they have a BMI of 30 or higher, we do see a pretty significant and straight line increase. That percentage is currently 36.9%. So not quite, but about half of this are folks who are actually in a category of being obese. Each of these is closer to what we see nationally than what we see statewide. Statewide, these figures are not quite as high as we see here in Yellowstone. We've also seen some declines in terms of fruit and vegetable consumption. In our survey, we asked people a series of questions about the foods that they ate on the day prior to the survey. So we tie it to a specific time frame for consistency. And from that, we found that 27.7% ate a combination of fruits and vegetables equaling 5 or more servings per day. That is below the latest that we've seen nationally. It's also something that has declined pretty sharply in the last few survey cycles. I'll share with you anecdotally that we are seeing this consistently in other parts of the country as well. This has declined most consistently in the last 3-year cycle, but also going back to what we see here in earlier years as well. Next is a question that we asked around people's access to getting healthy foods and specifically being able to access fresh produce at a price that they can afford. And here we found that 17.1% of residents reported that it's very difficult or somewhat difficult for them to find affordable fresh produce. And again, women were impacted by this more than men, and certainly those in lower income households, much more likely to report difficulty accessing fresh produce. That was one of the measures that I included in that initial chart, divided by income. I did want to note, however, that this percentage is something that has improved. We just asked this question first in the last survey assessment, 2017, but it is lower this time than what we saw in 2017. So hopefully that is a trend that can continue going forward as well. We also asked a number of questions around physical activity, and specifically asking people what types of physical activity they've engaged in the past 30 days. Also asking them about how often and for how long they did these activities. And from those series of answers, we were able to calculate whether people are meeting the CDC guidelines for getting enough physical activity. And we found that in Yellowstone County, it's certainly a minority of residents, 23.3%, but that is not all that different from what we see statewide and nationally. It's also about 21 to 23% who are getting enough physical activity. In a series of questions, we also asked households with children about a randomly selected child in that household, and then from that, we found that parents report that about 2/3 of children meet the physical activity recommendation, which is at least 1 hour of physical activity a day per child. That's better than what we see nationally, where it's at right about 50%, so that's a positive. Kids appear to be more active here than at least throughout the nation overall. We found that 16.6% of adults say that they don't get any type of physical activity outside of work, whether, regardless of how frequent or intense or often. That is something that is lower than what we see statewide and nationally, and something that has improved. So that does kind of bolster this indication that folks are trying to increase physical activity, but may not yet be meeting thresholds to meet recommendations. We also asked about screen time for both adults and kids, and specifically about screen time for entertainment, including not just television, but also computer time related to entertainment, use of cell phone screens, tablets, other types of devices. And we found that adults report, about 45% of adults report getting 3 or more hours of screen time for entertainment per day. For kids, they report about 1 out of 4 has that level, 3 or more hours of screen time per day for entertainment. The next topic area I want to talk about is something we call potentially disabling conditions. And I think you'll understand once we get into this what this means, but these are typically conditions that tend to limit our quality of life, our mobility, and such. So one question that I wanted to share is one where we asked people about activity limitations. And we found that 30.7% of adults in Yellowstone County say that they are limited in some way, in some activity, because of an ongoing physical, mental, or emotional health issue. And that is higher than what we see nationally. And looking at how it breaks out demographically, as you might expect, it does increase with age. Older folks past the age of 65, in fact, over half report some type of activity limitation. But it's also very strongly correlated with income. Again, this low income category are folks below 200% of poverty, well over twice the prevalence that we see of those at middle to higher incomes. Now the types of activities that these reflect most often are issues of mobility or musculoskeletal type issues, things like arthritis, difficulty walking, back, neck pain. Those were the most frequent types of responses. Over time, we've seen an increase in this prevalence as well, particularly since 2014. We've seen some increases to now what is the highest level we've recorded so far. In separate questions, we also saw relatively high prevalence for things like chronic back pain and osteoporosis in older adults in Yellowstone County compared to what we see nationally. Another measure that we looked at, which is kind of the flip side of this, we found that a relatively high percentage of adults say that they themselves are taking care of someone, a family or a friend, because of an ongoing health problem or long-term illness or disability. That's higher than what we see nationally. We've seen some increase since this was first asked in 2017 as well. And I've shown here what are some of the most common conditions affecting the people that they are caregivers for. Top of that list were issues related to mental illness. Many related to old age and frailty, and also dementias and other types of cognitive impairments. So those are kind of the top reasons that people in Yellowstone County may be providing care to a friend or a family member. Moving down our list here, next is respiratory conditions. We looked at a few different measures here. This chart represents mortality rates associated with lung disease, specifically chronic lower respiratory disease, or CLRD. And this is a collection of lung conditions that includes things like chronic bronchitis and emphysema. And you can see that rates in Yellowstone County over the past decade have remained higher than what we see statewide, what we see nationally. That's true in the latest reporting year. And in fact, we've seen some increases over the last few reporting cycles. So an emerging trend increasing mortality associated with lung conditions. Looking at prevalence in our community, we asked in our survey about COPD, chronic obstructive pulmonary disease, which is a similar collection of conditions that also includes things like chronic bronchitis and emphysema. And we found that 11.2% of adults in Yellowstone County have had a diagnosis of COPD. And that's higher, particularly in comparison to what we see statewide. It's also higher than what we've seen in prior survey administrations in Yellowstone County. So this too is something that is increasing. I wanted to share one slide around sexual health and specifically around sexually transmitted infections from some of the disease conditions that are reported to public health among diagnoses in Yellowstone County as well as statewide and nationally. We do see a few that are unfavorable for the county, particularly gonorrhea rates in Yellowstone County that are a little bit above what we see nationally and particularly high in comparison to the state average. These are incidence rates, so that's a number of cases, new cases per year. HIV prevalence, so this is cumulative total of cases of HIV in the county per 100,000 population. You can see the rate in Yellowstone County is well below what we see nationally, but it is higher than what we see across Montana. You're almost there, folks. Substance abuse. Again, this was another top concern for key informants in the community. So I wanted to share some of the findings that we had through our data collections. We looked, for example, at deaths associated with chronic liver disease and cirrhosis. And although not all of these are alcohol related, alcohol is a leading contributor to liver disease mortality and cirrhosis. And you can see in Yellowstone County that we've had kind of an uneasy upward trend over the course of the last decade. And currently we sit right between national and statewide mortality rates. In terms of looking at deaths associated with the ingestion of drugs, so unintentional deaths, so excluding suicide, accidental deaths associated with the ingestion of a drug, whether it be a prescription drug or an illegal street drug, the rates for Yellowstone County remain about half what they are statewide, and about a third of what they are nationally. The counts are such that we are really not able to establish a trend as of yet. The good thing is there aren't quite enough deaths to look at individual years at this point, which is good for us, but unfortunately it doesn't allow us to look at an emerging trend for that, at least as of yet. But we did have a question in our survey, and as you might imagine, it's difficult to ask about illegal behaviors. Instead, this question asks about what people feel the impact of substance abuse has been in their life. So the degree to which they feel that their life has been directly and negatively impacted by someone's substance abuse, whether their own or that of someone they love. And what we found is that over half of adults in Yellowstone County, 53.8%, feel that they themselves have had an impact in their life because of someone's substance abuse. Much higher than we see nationally. Demographically, we see it much more impactful in that lower income segment, a bigger impact on women than what we hear from men. And something that has increased pretty significantly since we first asked this in 2017. So we've gone from 45% roughly to almost 54% currently. So absent some of the other data that we have, it does look like this is an issue that is impacting now a majority of our residents. So then the last topic area that I want to share with you is around tobacco use. Historically, we've looked at cigarette smoking in the county, and we are currently at the lowest prevalence of tobacco use that we have. Well, I guess we did have a little bit lower rate there, but we are significantly below our baseline measure and certainly below what we saw in 2017. The prevalence of 11.9% of adults who say they smoke every day or on some days is well below what we see statewide and nationally as well. However, what we are seeing at the same time as that is decreasing is about 8% of adults who currently use e-cigarettes or vaping products to vape nicotine and other substances. 7.9% currently use some type of vaping product every day or some days, higher than the latest data from the US or Montana, higher than what we saw in 2017, although that difference isn't quite statistically significant. I'll share with you that in most communities we have seen a pretty notable increase. So my estimate would be that that is a true increase in the population. We also saw it more prevalent in younger adults, of course, than in older adults, and also in lower income segments versus those at higher incomes. So consistent to some of the demographic patterns we've seen with traditional smoking, we're also seeing those with e-cigarettes and vaping products as well. So with that, I want to I want to ask Hannah to join me here to kind of talk about what we're going to do, but we're going to take a break and move around the room and get some of your input around some of these issues. So.
All right, everyone, let's thank Bruce for his amazing brain and mind